Good morning everyone. This is lesson 18, the shoulder complex. At the end of the lesson, the students should be able to identify the bones, articulations, stabilizing ligaments, and musculature of the shoulder complex. Explain how the shoulder injuries may be prevented and the process for assessing the injuries, and recognize the specific injuries that occur around the shoulder joint and describe plans for management.
Hi guys, this is Joshua Vasquez, and for this video, we will talk about the prevention of shoulder injury. Prevention of shoulder injury. So, the good news is that shoulder problem often can be fixed without surgery. Still, it is the best to avoid the problem in the first place. Here are some ways to do that. First is that listen to your body. If your shoulder gets hurt, or sore after any activity, don't ignore it. If the pain is serious and it doesn't go away, see your doctor. There is no need to thought it out. You just might make the things so worse. Second is, stay in shape. Keep your body in a good physical shape.
Next, we have recognizing and managing injuries of the shoulder. What are the common causes of a broken collarbone? Includes falls, sport injuries, and vehicle trauma from a car accident. So we have here the signs: pain that increases with shoulder movement, swelling, and grating or crackling sound when you try to move your shoulder. So we have here the proper care of a clavicle fracture. Most clavicle fracture can be treated by wearing a sling to keep the arm and shoulder from moving while the bone heals. Fractures of the humerus. Causes of injury and any hard blow or injury to your arm can result in a humerus fracture, but some are more likely to cause certain types. For example, breaking your fall with an outreached arm can often cause mild shaft and proximal humerus fractures. And treating a humerus fracture depends on several factors, including the type of fracture and whether there are any losses bone fragments. To determine the best treatment, your doctor will start by taking an x-ray of your arms. They may also have you do some movements with your arm. This will help them to determine what kind of fracture you have and whether you have any other injuries. Sternoclavicular joint sprain. These injuries are rare, requiring an accident with a lot of force, such as a tackle in football. Most sternoclavicular sprains occur when an athlete is struck on the back or side of the shoulder. For an AC sprain, treatment may include icing, inflammations, or pain control with medications, and using a sling or a brace. Next, we have acromioclavicular joint sprain. The most common mechanism of injury is a direct trauma to the lateral aspect of the shoulder or acromion process with the arm in adduction. Falling on an outreached hand or elbow may also lead to the AC joint separation. Acromioclavicular joint sprains in grades 1 or 2 sprains, the injured shoulder is treated with rest, ice, and a non-steroidal anti-inflammatory drug such as ibuprofen to relieve pain and swelling. Glenohumeral dislocation, it is around the shoulder. And if you have this situation, in order for you to recover fast, you need to apply an ice. It helps to release inflammation and pain and rest your shoulder. Don't repeat the specific action that caused your shoulder to dislocate. And it takes about 12 to 16 weeks to completely recover. Shoulder impingement syndrome. A joint stands as a rotator of the shoulder. To prevent this syndrome, increase your training gradually at a reasonable rate. Do not do too much too soon. And balance your muscle training. It takes 3 to 6 months of recovery. Rotator cuff strains are caused by overuse or active injury. Example, car accident. To recover Fast, go to physical therapy and keep a good posture and avoid activities with repetitive overhead arm action. It takes 4 to 6 months or longer to recover. Shoulder bursitis is an inflammation of the bursa in the shoulder. And to prevent this fracture, avoid doing things that cause pain, and it takes 2 to 8 weeks of recovery. And the last one, biceps tenosynovitis. The biceps tendon cruises the joint, is both a dynamic and static stabilizer of the shoulder. To prevent this, do warm up and stretching every time to start a game.